He is our featured beneficiary today. His name is Raven. When he was just a baby, he was diagnosed with retinoblastoma bilateral stage 4, a cancer of both eyes. The goal of this channel is to find assistance for the sick and poor children in the Philippines who are crying out for help.
Raven is turning 8 years old on August 7th, 2023. He is a member of the GAAF Kids Birthday Club, or JKBC, and is excited to have his birthday cake. Raven is the second youngest of 8 siblings, 6 boys and 2 girls. He will receive a cash gift of 1,000 pesos on his birthday from the sponsors of JKBC. Raven's eye problems started when he was only 1 month old. He was excessively crying when the mother discovered that his right eye had a white pupil instead of the normal black one. He was rushed to the Philippine Children's Medical Center, or PCMC, and was diagnosed with retinoblastoma bilateral stage 4, eye cancer in both eyes. Due to the enlarged tumor and loss of vision in the right eye, Raven, at 3 months old, was immediately operated on to remove the right eye. Then he underwent a series of treatments such as chemotherapy, cryotherapy, and laser therapy to save the left eye. Frequent follow-up appointments were scheduled to check how the treatment is going and whether it has spread outside the eye into surrounding tissues or to other parts of the body. Raven does have a family history of this disease through his father's side. His grandfather's brother had bilateral retinoblastoma diagnosed as a baby and was left untreated and thereby lived without sight until his 30s. Unfortunately, in 2017, 2 years after the surgery, the cancer came back. This time, more aggressive treatment was administered. A series of tests such as MRI or magnetic resonance imaging, EUA or examination under anesthesia, X-ray for bone scan, CBC, and LDH were done to monitor the size of the tumor and check if it has begun to spread into other parts of the body. Sadly, it had spread to the lungs but successfully treated with chemotherapy. In some cases, these series of checkups had forced the mother and son to stay and sleep outside the hospital vicinity, sometimes for a week, to save transportation expenses going to and from the hospital. They just shower and change clothes at the hospital. This way, they were able to save about 500 pesos for food and transportation each time they travel from their residence in Norzagaray, Bulacan to PCMC in Quezon City. It takes 3 rides, a tricycle, a jeepney, and a bus to get to the hospital. In 2019, when Raven was 4 years old, new tumors had been found in Raven's left eye again. This is when the mother was told by the eye specialists from different hospitals that there is a newer technique that they want to perform on Raven in order to save his left eye. It is called intra-arterial chemotherapy, which was injecting chemotherapy into the eye. She was told that this is the first time in the Philippines it will be administered to a patient. If this fails, Raven's left eye will also have to be removed. This was a very painful process for Raven, and when the general anesthesia was gone, he would cry in pain and could not open his eyes for 1 day. In 2020, during the pandemic lockdown, Raven was assisted by the Norzagaray municipality, which provided an ambulance to take him to the hospital for his continuous chemotherapy treatments. Luckily, at this point in time, Raven's left eye is clear of cancer. They were able to save his left eye and vision. He just needs to wear eyeglasses for clearer vision in his left eye to help him at school. A regular MRI and EUA and other tests are necessary to see if a new tumor has grown. Every checkup at the hospital is a struggle for money. Raven does not receive any disability money from the Philippine government. His mom goes to the city hall for ask for help. Sometimes she is given 500 pesos, but most of the time she is asked to wait and come back. There are months when she is not given any help at all. Raven's father lost his job as a construction worker during the 2020 pandemic and never got back to working again. He became an alcoholic and started gambling despite being unemployed. He got into trouble and went to prison for a year. Upon returning home, he began to abuse his wife and children. According to Raven's mother, this may have contributed to why 3 of the 8 kids are now suffering from depression, and 2 of them are currently confined in the hospital. She said that she herself is feeling depressed, but had to be strong for the sake of the children, especially Raven, who is experiencing a serious illness. To survive, Raven's mother is running a small sari-sari store selling turon, banana Q, drinks, and other snacks and food products. However, her capital is from a Bombay usurer who comes and collects $500 every day for her installment. She barely makes income after paying the monthly store rent and the daily installments to the Bombay usurer. The big challenge is when she closes the store to bring Raven to the hospital. She also scavenges in the market trash for food that is nearly expired. Some vendors who know her already set aside the expired food for her instead of throwing them in the trash. This helps in times when all the money goes to the usurer and there is no food to serve on the table for the family. With this family situation, there is clearly no support at all for Raven's medical needs. Raven said that he is tired of being bullied at school. He looks forward to continuing his studies for a better future if his health improves through nutritional food, vitamins, and continuous checkups and medications.
Retinoblastoma is a cancer that starts in the retina, which is the very back part of the eye. It is the most common type of eye cancer in children and may occur in one or both eyes. Retinoblastoma occurs when nerve cells in the retina develop genetic mutations. These mutations cause the cells to continue growing and multiplying when healthy cells would die. This accumulating mass of cells forms a tumor. Approximately 60% of cases of retinoblastoma are not hereditary, and 40% are hereditary. All of the non-inheritable cases affect only one eye. Of the 40% of cases that are inheritable, approximately 85% of patients will develop multiple tumors affecting both eyes. This is the case with Raven, since he does have a positive family history of this condition. Retinoblastoma has few, if any, symptoms at first. It may be noticed if a pupil appears white when light is shined into the eye. Eyes may appear to be looking in different directions. Other symptoms include a red, painful eye, enlarged pupil, different colored irises, and poor vision. Treatments include chemotherapy, radiation, and laser therapy. Treatment of progressive or recurrent retinoblastoma may include external beam radiation therapy or plaque radiotherapy, cryotherapy, thermotherapy, systemic chemotherapy or ophthalmic artery infusion chemotherapy, intravitreal chemotherapy, or surgery to remove the eyeball completely. Raven had these various treatments, including surgery to remove the right eye and intravitreal chemotherapy where the anti-cancer drug is injected directly into the eye. The 5-year observed survival for retinoblastoma in children 0 to 14 years of age is 96%. This means that, on average, 96% of children diagnosed with retinoblastoma are expected to live at least 5 years after their diagnosis. Raven is currently in remission and with close monitoring will hopefully be able to live a long, fulfilled life.
I would like to invite you to become an angel to Raven. You can be an individual, a group of friends, a corporation, or an organization. All donations are tax deductible. Your cash support will greatly help out Raven continue his hospital checkups to monitor if there is a new tumor growth in his left eye. Recurrence of cancer is imminent, and it is important that frequent eye exam is performed. Raven will also need money to pay for various tests that are not covered by PhilHealth. He will also need an allowance for transportation and food expense during hospital visits. We asked the mother what are her wishes for Raven. She said that Raven needs a replacement for his eyeglasses. When a classmate bullied him, the eyeglasses was pulled from him and broke. It was never replaced due to lack of money. Thus, Raven struggles in learning from school due to his blurry vision. The cost is around $2,500. Raven's artificial right eye had to be replaced every year, but was not done so due to lack of money. He is being bullied at school by other kids because of his appearance without one eye. According to the mother, Raven's maintenance consists of the eye drop for the saved left eye, which costs around $650 and lasts for a month, and an ointment for his right eye, which is applied when the right eye gets sore due to the artificial eye. This costs around 650 pesos also, which lasts for about 2 weeks. He will also be needing to take his multivitamins and supplement and nutritional food for stronger immune system. He is likely to develop health inequities if his immune system is weak. Raven loves to sing and is thrilled to learn the guitar. Learning a new skill will help boost his morale and will prevent him from experiencing depression and other mental health issues. Raven's mom is desiring to start a piggery, even with just one pig, in order to make extra money for Raven's medical needs. Piglet costs around 4,000 pesos and could be sold between 10 to 15,000 pesos after 3 months of raising it. This will be a big financial help for Raven and the family. It would be a big help for GAAF USA TV if you can click the like, share, and subscribe buttons, including the notification bell so you don't miss any of our future videos. Thank you for your support.